people say they have high blood pressure, that's because there's potentially a narrowing of their blood vessels. So the blood has less space to go through. So it's kind of like squeezing a hose pipe that it shoots out faster. Is that typically what it means by high blood pressure?
Sort of. Let me explain. When your insulin levels are running high, all your blood vessels and your capillaries all don't vasodilate properly.
Oh, okay. And vasodilation is the expansion and shrinking.
Yeah, so they don't vasodilate properly, so you will get high blood pressure. So one of the biggest things I've noticed with diabetes patients is when I bring their insulin levels down through my fasting program and dietary changes, the blood pressures go away. See, that's another thing. There's no such thing as essential hypertension. Essential hypertension meaning that you just have high blood pressure. There's always a cause. Either you have sleep apnea or you have hyperinsulinemia, because sleep apnea also causes hypertension. So hypertension does not always necessarily mean that you're going to be committed to blood pressure medications for the rest of your life.
I've heard you talk quite a lot about breakfast. People ask you about what they should have for breakfast because everybody wants to know how they should be starting their day. What is your advice on what we should be eating for breakfast to have a healthy heart and cardiovascular system?
Breakfast is a tough one. I tell most of my patients that if you absolutely have to have a breakfast, have a couple of eggs. And if you are a vegetarian, it makes it a little bit more tough. But you can have some kefir with 2 to 3 blueberries, 2 to 3 blackberries, and about 4 blueberries in it. And then you put your inulin powder in it, and that's your breakfast. That's all you should have. But a heavy breakfast, and also breakfast, in my opinion, breakfast we should pass breakfast for most adults and just go for lunch and dinner only.